This week, we're experiencing the first extreme heat of this year. Wish TV's medical expert, Dr. Janel Gordon, is here to help us navigate these temperatures safely. You know, Ryan Morse was just telling us that heat, #1 weather-related cause of death when it comes to weather-related deaths. We often talk about heat. We've had these kind of temperatures before, but not yet this year. Why is it so important to recognize the risk of heat-related illness?
Yes, so heat illness can range from mild abdominal and leg cramps to heat exhaustion, where individuals may find themselves profusely sweating, they're nauseous, they may vomit, headaches, and including as severe as heat stroke, where individuals may even lose consciousness and suffer permanent cognitive issues. Up to a third of individuals with heat stroke will.
I'm a mom. I have kids headed to camp this week. My daughter's camp is mostly outside, so I'm thinking, who's most at risk for this, and how do we handle that?
Yes, so children like your daughter, infants, our seniors, anyone working outdoors like our construction workers on the highways this summer, as well as athletes who are practicing and training and playing this summer.
And if you have a medical condition too, you're at risk?
Yes, so chronic medical conditions such as lung diseases, asthma, COPD, or chronic obstructive pulmonary disease, heart disease, and as well as medications that we prescribe to treat some of these chronic conditions.
What are some of those medications, if anyone's on them?
Yes, so blood pressure medications or heart medication such as calcium channel blockers, beta blockers, and diuretics. Allergy medicines like our antihistamines that a lot of us are taking around this time of year, antidepressants, antipsychotics, stimulants like we might prescribe for individuals who have ADHD, laxatives, and even medications that oftentimes our seniors are taking as a result of their urinary incontinence. Any individual taking these medications should speak with their doctor and make sure that they take precautions during these high temperatures.
When you mentioned this, a lot of those are like dehydrants, so that makes sense that would put you more at risk. What are some things that we can do to prevent these heat-related illnesses?
Yes, so stay indoors if you can, especially during the hottest times of the day. So honestly, when your daughter is out there at camp, if they can take shade for a couple hours at a time and then go back out, or always be near more cool water, have misting fans around, or handheld fans that they can use, cool towels around their neck that can keep them cool during these high temperatures. We always want to make sure that we're applying sunscreen at least 30 minutes prior to going outdoors, and then reapply every couple hours or any time that you're sweating, which will be often during these high temperatures.
You're making me feel better because I got her the cooling towel and the misting fan, so those are some things you'll want to have if you have to be outside or work outside. At what point do you say, hey, you need to go to the doctor?
Yes.
What point is that?
So anytime an individual is having those cramps that I talked about, or if they're having more of those telltale signs of heat exhaustion, get to a shaded area, cool down. You want those towels around the neck and the armpit, even in the groin, and slow sips of water we recommend over large gulps, and making sure you're avoiding sugary beverages and alcohol. And then if those individuals do not improve within an hour, they need medical attention. When it comes to heat stroke, the most severe form of heat illness, these individuals need emergent medical attention because time is brain.
Okay, and we're looking at little kids, you know, playing in the splash.
Yes.
Maybe you can get outside, but just keep it limited if you are, and then take these safety precautions in the process.
Yes, keep it limited and pay attention to what I share also in the article on wishtv.com, because there will be additional helpful tips.